Hi everyone, and welcome to Module 3 of the course, The Effect of Aging on Economies, Real Estate, and Financial Markets. So I'm Dr. Ira Sobel, and I'm the founder and academic director of FinTech for Longevity Academy. And throughout this module, we will focus on exploring the reciprocal relationship between society, healthcare, and aging. We have 3 lessons and 3 case studies in this module. Lesson 1 will provide an in-depth analysis of the definition of lifespan and healthspan. And following that, Lesson 2 will concentrate on the social determinants of health, supplemented by a case study demonstrating the gender gap in healthspan and lifespan, along with their determining factors. Lastly, in Lesson 3, we will examine the impact of aging on healthcare system, and we will showcase the profound influence of aging on healthcare landscape of Japan, a country renowned for its best healthcare system. So furthermore, we will investigate the influence of this relationship within the United States. Why United States? Because United States is positioned as an outlier in terms of the correlation between healthcare systems and life expectancy. So without further ado, let us commence with lesson number 1. So firstly, let's define lifespan and healthspan. So as you see in the slide, lifespan refers to the duration of an individual's life from birth to death. Easy. It represents the chronological age of an individual and is often measured from the age of 60 and above. Why? Because the latter approach acknowledges the perception that reaching to the age of 60, if somebody has reached or survived until the age of 60, it increases the likelihood of living a longer life. So therefore, it's essential to consider lifespan not only at birth, but also from the age of 60 and onwards. So after we understand what lifespan is, now let's move on to healthspan. And let's explore what healthspan is. And this is an emerging concept that encapsulates the duration of one's healthy lifespan. Healthspan refers to the period in individual's life free from chronic diseases and age-associated decline. So healthspan represents the time spent in good health. For instance, if an individual lives until the age of 85 and experiences the onset of illness at the age of 75, for example, we can determine that their lifespan was 85 years and their health span was 75 years. 75 years in good health. Measuring health span poses more challenges compared to lifespan, as there is no established metric for determining its endpoint, unlike the average lifespan. So, the World Health Organization has introduced an indicator called Healthy Life Expectancy. The acronym is HALE, which attempts to address this by calculating the average age of disease onset and its incidences. So let us now examine a few examples to illustrate lifespan and healthspan. For example, look at the first row. An individual with a lifespan of 85 years, however, with a quite low health span of 50 years. What does this imply? This implies that they enjoyed good health for 50 years, while chronic diseases and disabilities for 35 years, meaning that their lifespan is 85 and the health span is 50. 50 is the time of onset of chronic diseases and disabilities in this case. Now let's move on to the second line. And in the second line, we can see a different condition. And let's consider an ideal scenario where individual lives to the age of 100 with 100 years of lifespan and 90 years of health span. So what does the second line indicate? 90% of their life was spent in good health. However, it's important to note that this may not be the ultimate outcome. Let's see in a minute the ultimate outcome. So let us examine another scenario where individual lives under the age of 85 but experience 10 years in poor health. In this case, the onset of disease occurred at the age of 75, so living up to the age of 85 with 75 is the 75 years of health span. Given this consideration, I would like to ask you, which scenario would you prefer? Would you choose to live until the age of 100 and 60% of life in good health and 40% with poor health? Or would you opt for living until the age of 70 with 69 years in good health? What would you prefer? So this is a thought-provoking question, as people have different aspirations for their preferred way of life. So who should we mention here? It is not worth it to mention Queen Elizabeth, and she serves as an exemplar of the ideal outcome. She has lived until the age of 96, functioning as a monarch until the age of 95. In this case, her husband accounted for 95 or even more of her 96 years of lifespan, aligning closely with the ultimate condition, where lifespan and health span are nearly identical. So it's not only about longevity. It's not only about lifespan. It's also about our quality of life and how much is health span and lifespan identical. However, the path to achieving this ideal outcome of converging between health span and lifespan and extending lifespan poses both opportunities and challenges. Let us begin by exploring the opportunities. Today, efforts are underway to increase health span by focusing on slowing down the fundamental biological process of aging. And this entails optimizing physiological functions, promoting physical activity, regulating energy intake, and developing pharmacological agents aimed at slowing down the aging process. But these opportunities, as you might know, aim to extend health span, ideally achieve a convergence between health span and lifespan. However, several challenges and significant obstacles hinder this attainment of optimal longevity. Let us delve into these challenges. Overcoming the progressive decline in physiological function is a considerable challenge. An age-related physiological decline leads to functional limitation, in increased risk of chronic diseases, disabilities, and mortalities. However, addressing these issues and extending health span is a complex endeavor, and interdisciplinary collaboration is essential because we need to involve all the stakeholders from basic sciences, public health, and other relevant fields in the gerontological space. So, at this juncture, a pivotal question arises. Is aging itself a disease? While some argue in favor of labeling age as a disease, aiming to find a cure for this disease called aging. So it is interesting to understand that health is not the sole determinant of health, and of course, longevity. We will delve in deeper into the other determinants of health and longevity in lesson 2. So thank you very much for your presence and active participation in lesson 1, and we look forward to continued engagement in lesson 2. Thank you.